Everyone, I'm Dr. Steph. I'm one of the lecturers for the U of T Financial Literacy curriculum. Today's video covers an important topic, which is career planning. Because a lot of the current career planning in our medical schools is focused on, understandably, preparing students for the residency match, but there are actually so many other career paths out there, especially for physicians. So today I'm joined by Dr. Ken Bernard, who is an Anishinaabe emergency medicine physician. He did his bachelor's at Yale and MD MBA at Harvard. He is currently the medical director of Alteon Health and co-founder of the Native American Emergency Medicine Consortium and the Pinnacle Emergency Medical Group, which provides locum services to Native reserves and rural areas. So thank you so much for joining me today and being an inspiration for our Indigenous students. So my first question for you is, can you just tell me a little bit more about yourself and what kind of career path you went into?
Oh, certainly. Well, Stephanie, thank you so much for the opportunity. And thank you so much for the students, the residents, and the folks that are contributing to this important curriculum and giving me the time and space to contribute. As Stephanie had said, I'm Anishinaabe. I'm Turtle Mountain Ojibwa from Belcourt, North Dakota, and I grew up around that area. I now live in Northern Virginia, and I am the medical director and chairman of Prince William Medical Center, which is a part of the University of Virginia Community Health. I oversee an emergency department that sees roughly 40,000 patients per year, has 20 plus clinical staff on board, and have been only doing that for the past 9 months or so. I recently transplanted from my work, as you had mentioned prior, in the Southwest, where I was a director of a level 3 trauma center on the Navajo Nation, and then also founded a small emergency medicine services company or locums company, whose primary focus and mission was to staff and bring high quality emergency care and acute care to Indigenous populations. I guess that's a little bit of what I do, but that's not totally who I am. Well, who I am is a dad of 2.5 kids. I live with my best friend and wife, Kelly, and we just celebrated our 10-year anniversary this last May. We have a 6-year-old and a 2-year-old, and we have one on the way. So I'm a dad first. I'm an almost 40-year-old triathlete and obstacle course runner with middling performance that seems to be declining. I'm also a health advocate and researcher in minority health, especially acute care issues that challenge our minority populations. And then furthermore, I think the other hat that I do like to put on, which is why I think I'm sitting in front of you today, is that I really do enjoy mentorship and coaching, in particular with folks that are thinking about going into the medical sciences and health professions community. In particular, if you think you've come from a disadvantaged or challenged background, and certainly if you think you have an interest or not seeing the entire picture or total picture with just medicine and biomedical sciences, and worried or concerned about where our health professions are going and whether or not you can have a different impact other than just being a doctor. And it's even kind of funny of me just to say that just being a doctor seems not to be enough these days, or our communities and patients are needing us to be much more. And I guess I would owe that perspective and or that insight to my mom. So my mom is also a physician. She's a family medicine doctor. She's been, a community health director and a medical director for maybe the past 2.5 decades. Initially for a small reservation in northern Wisconsin, and now for a smaller reservation in northern Michigan. When I thought that I wanted to go into medicine, or had the first inkling that I wanted to, she said, "Okay, I support you, but it's going to be tough. It's going to be tough for a few reasons. One, because of where you come from and the fact that you are going to be living in two worlds." And what she was meaning is, the traditional aspect and culture and history of where we come from on the reservation, and then secondarily being, having to become fully acclimatized to a Western view of medicine, health, and wellness. And then she also said, if anything that I've learned over these past few years, at least in her career, which was early at that time, she said, "You are going to have to be more than a physician. you are often just going to have to be a counselor. You're going to have to be an advocate. Sometimes you're going to have to get deep into some social, political, and even legal issues that you never thought that you were going to have to manage. And furthermore, she said, you are going to have to understand the business of medicine, which is a completely different language. You know, we think about taking anatomy and physiology, we think about taking immunology and all these basic science classes, and we learn a language and we learn a way to communicate with other professionals in that realm. Business and administration is much the same way. Of course, dealing with a lot of functions such as accounting and finance and now technology and entrepreneurship, but there's a language and a way that you carry yourself that you're going to have to learn and understand. And that's what I think sort of created my initial pathway of, I love medicine and I love what I do as a practicing clinician first and foremost. We'll do that until I can't do it anymore. But then also got interested in, and maybe there's another way that I can try to piece a career together by going into healthcare administration and business and entrepreneurship, which I never thought I would do, but had opened up all these other avenues, windows, doors, and opportunities for me simply through meeting different people, having similar ideals and values, and then saying, oh, darn, that seems really interesting. Let me see if I can look at that. And that's how I got to where I'm at today. So my primary function is, as I said, as the medical director and chairman of an emergency department. Secondarily, I sit on the board for our combined company that came together, which is ARC Health, which is a public benefit corporation with a mission to, again, close the gap in health equity and social justice as it pertains to acute care, specifically Indigenous populations, but also rural health situations. And I'm a specialty advisor to that board. Some of my other volunteer work includes working with the Emergency Medicine and Rural Indigenous Care group, which was formerly the Native American Rural and Emergency Medicine Group, which now puts together an educational consortium and is really a group of rural and Indigenous care providers that want to share ideas, education, and just network and talk a little bit more about the problems that affect our communities and some innovative solutions around that. And I say outside of that, that probably occupies most of my time. And then of course, you know, being the full-time dad on the other aspect of it as well. So that's, I guess, my initial intro. And if you had any further questions, I'd be happy to elaborate. But I really don't like talking about. I really don't like talking about myself all that much. But that's it.
Yeah, and it's a very interesting background. So I was wondering next, what made you decide to choose emergency medicine as opposed to any other specialty to go into that path?
Yeah, I initially thought I was going to be an interventional cardiologist. I was like, you know what I want to do? I want to open up the first mobile cath unit. You know what I mean? Like set myself up right next to an IHOP or a Sizzler, and when people are having the big one, just like hook them right up into my mobile unit. But then I realized what I really enjoyed was the upfront and acute care. So I really enjoy, you know, malignant arrhythmias. I enjoy the initial upfront care of initiating the STEMI. And then I go deeper into it and said, well, I really think the benefit of emergency medicine as far as a societal or community benefit is that if I make the right decision upfront in somebody's care, that is, initiate treatment sooner, find a diagnosis right away, I can start them on a care trajectory that will completely change their lives. Meaning, if I make the right decision, they're going to stay in the hospital for a less amount of time. They're going to receive the appropriate care, receive the appropriate follow-up. That first definition or transition point there, I can have a really big impact. I also can do a lot of harm. And I felt that my personality was one where I was okay with that risk-benefit ratio. I was okay with making decisions with uncertain information. And certainly another aspect of care of emergency medicine that I really appreciate is that our patient population that we get to serve. Often I think referred to as, you know, the least, the last, and the lost of our communities, which have not a lot of access to care, are underserved, have a lot of complex comorbidities, including psychiatric and substance use disorder. I think those are the most challenging patients to deal with on a daily basis. And I find that more than anything more intellectually fulfilling and challenging, which is why I think I like emergency medicine. I think the selfish lifestyle aspect of it too is, I mean, even though I'm not technically off as a director of an emergency department, I like the fact that I can clock in and clock out. I like the fact that, you know, when I call my patients and follow up, they're like, oh darn, I've never gotten a follow-up call for an emergency medicine physician before. Or when people say, are you my regular doctor? I'm like, no, I'm not supposed to be your regular doctor, but I do see you a lot in the emergency department. How can we avoid you coming back to the ED, and can we get you a regular physician? So those certain lifestyle aspects of emergency medicine are what I enjoy as well. Not having to be on call, and when I'm off, my time is my own to figure out what else I need to do, or what else I want to do.
So getting into like the why MBA question, because I know that there are certain specialties such as emergency medicine where we actually do see a lot of MD MBAs. In cardiology, I don't see that as much amongst my colleagues, at least. So did you ever find that emergency medicine is one of those specialties that are more accepting of MD MBAs, or is it kind of just all over, all the specialties have it?
I think it's all over. I think you could do that. I think MBA or Masters of Public Health and Health Administration, probably. And I don't think it lends itself to any one specific specialty, with the caveat, I will say, in emergency medicine, being the front door to the hospital, having so many relationships because you interact with every ancillary service. And when, at least in the US, you account for the majority of hospital admissions, so that particular service line needs to operate really well. I think it lends itself to people who like complex operations. And again, when you're working on these margins that are, you know, fairly thin, and you're given a lot of free care or uncompensated care out to this populations. You're dealing with a ton of regulation. We're about to have another Joint Commission annual survey, which is the body that comes through that says, yep, you guys are doing all the right stuff that you need to be to continue to see patients that are covered by Medicare and Medicaid. So it's a really important process. So I think the regulatory pressures, the financial pressures, the operational challenge, I think that's what lends itself to people wanting to understand, like I said, that other aspect of medicine, which is the business side of it. But I wouldn't say that emergency medicine lends itself totally to that. I think it's probably a personality, and people that are interested in being healthcare executives, or starting your own service line, or starting your own contracts and starting your own company. But I do have a story about that, about how I got into the MBA. Is that okay to share?
Yeah, no, for sure.
So I did go to Harvard, and in medical school, I didn't necessarily think that I was going to do the MBA, or you know, wasn't interested in that track initially. But then we had the first discussion, or first talk, was the introduction to social medicine. And that was a program that was run by Paul Farmer, who recently passed, sadly, and then his partner, Jim Kim, who gave that initial talk. And Dr. Kim gave a discussion, and he opened it up to be like, if I had to do it all over again, I don't necessarily think that you guys are sitting in the right seats. If I were you, I probably would go take some classes across the river. And he was talking about Alston or Cambridge at the business school. And he followed up and explained why. He said, because, you know, despite all my experience, despite all my advocacy, somehow McDonald's has figured out how you can get a Big Mac in sub-Saharan Africa quicker than you can get life-saving antiretrovirals. And that struck me immediately. That business had figured out some of these supply chain and let's call it product and services delivery issues that medicine was either too reticent or too slow to adopt and understand and be able to deliver. So that immediately sort of flipped a switch in my brain that said, okay, let me go see what the business school is about. And was, you know, took the GMAT, did terribly on it, which is okay. You can do terrible on tests, and you can explain why you did terrible. I'm not a very good standardized test taker, and was lucky enough to be accepted into the program, and so thankful that I did, because that experience in and of itself, we just had our gosh, I can't believe is that soon? Yeah, we just had our 10-year reunion that was delayed 1 year as a result of COVID. But some of the most enduring relationships and networking were some of my business school classmates. And some of the most insightful lecturers and speakers were some of my business school professors. And again, it was just interesting to see some of these other issues outside of the realm of healthcare, which is if you do something like a public health, or if you do something about a health administration, it seems like it's a little bit more focused, rightly so, within that sphere. Or if you do some sort of postgraduate program like a fellowship in health administration or a health executive type of program, that they seem to be so healthcare focused. I felt fortunate to have a more general view, but again, that's speaking from my experience and not knowing totally about all those other programs. So I apologize for folks if you're in that program now and it's completely wrong, and you are looking at cases like how Benihana was more successful with how they brought in patients and sat down all the patients all the patrons and got them all the meals that they needed very quickly, or how Zipcar decided where to start up and how much to charge for each one of their Zipcars. If that's actually happening, that's great. But that's sort of been my perspective on it.
Yeah, and I was actually at that 10-year reunion last week as well. But I guess I never ended up bumping into you.
Sorry.
There were probably more than 500 people, and across different sections too. So you touched a little bit on the different options, right? There's the MBA, there's the Masters of Public Administration, Masters of Public Health. And would you say that all of those paths can kind of get you to the same direction? Or would you say that there's anything additional that you would have learned from an MBA compared to other programs like that?
Sure. If I would think traditional pathways, when I think about MPH, it makes me think that you want to start to take more of a research track. So maybe writing papers or starting community health programs and public health programs. When I think health administration is you're signing up at that point in time to either be a CMO or a CEO potentially of a hospital or a healthcare system at some point in time. And as I said, with the MBA, they taught those other functions, which included leadership, but included other things like entrepreneurship, right? So how do you evaluate a business opportunity, and how do you continue to raise financing to grow it, and how do you decide when to get rid of it, which I think is sort of an added difference in the MBA that I don't necessarily know that they are teaching a lot in MPH or healthcare administration. So I think that would be a primary difference that I could see, or a very concrete difference, and I'm sure there are more, but I just can't think of them off the top of my head.
Yeah, so let's move on to the application process and what it was like to do kind of balance your MD and your MBA. So my understanding is that you did your MD and MBA at the same time instead of one after the other. What was that like? How did you balance your life doing both an MD and an MBA?
That's a good question. I think before that too is I think you could probably ask another question is would you have done it a different way? And meaning, would I have worked for a little while before doing the MBA and that would have helped? Or would I have worked in a different industry potentially, like consulting for a little while, which is what a lot of my business schools classmates did before doing the MBA. And I've always been intrigued by this. I think Harvard Business School, prides itself on bringing people from a lot of diverse backgrounds and as well as experiences, because we all feel like we had something to share. But to be totally honest, I was so underprepared, even with studying for business school, because I never looked at an income statement or a balance sheet before. Had never done a case other than like a patient case or a medical case review before. So that was challenging. I think if I would have done something else like consulting, or actually worked in another role, or even if I in my early days as being a practicing clinician, I may have had a little bit more experience that I could have brought to the table. But with regards to how the process worked out, it was very well planned as the dual degree program, in that, we did the first 3 years of medical school and clinicals. Then I would take a year break and did the entire what we call required curriculum year at the business school. And then in that 5th year, what we did was split the time between your elective curriculum as well as your elective clinical time. And as you know, in both those areas, you have a fair amount of elective period in which you can dig deeper into these, clinical issues that you wanted to experience. So I was able to, and some people, take a little bit of a time off or do a little bit of like cushy medical tourism. So I just decided that I wasn't going to have that. So, stayed in Boston for that entire time and did rotations and studies at the same time. And it was challenging, jam-packed. But again, that speaks to there are some skills that you're going to have to develop if you want to be in administration and a clinical leader, and more being any physician or any professional, especially if you want to grow a family, especially if you want to have interests outside the hospital walls. That time management is probably one of the most important skills that you can learn. And another reason you're going to need to learn that is because there are, and again, I'm obviously on a soapbox right now, and I apologize if I'm preaching or pedantic, but it's because there are so many distractions. There are so many things that are going to be asking for your time that you have, and it's going to be so valuable. And one of my business school professors who just gave another talk that sort of, made me reevaluate my entire life. He was one of those types of speakers. He said, time is the only thing that's not fungible in your life. So it's like, you can't replace it with anything else. So you better protect it pretty ferociously and decide what's really important to you, and make sure it's aligned with your values and where you want to go to next. So that would be a big point, is that anybody, if you're deciding to do this with your career, you don't have to make the right decision right away, but you certainly have to manage your time and protect it ferociously from anybody else who's trying to take it, and just assume that everybody's trying to take it.
Yeah, and that's a really good point. So out of curiosity, you entered business school in 3rd year of medical school. So it took you maybe about 5 years to finish medical school in total?
Yep.
Okay. And at the time, were you, in addition to being a medical student, did you have a family already at the time, or all that family planning stuff, it came after everything?
Yeah, it actually came after. Certainly, like I said, we just celebrated our 10-year anniversary, so it was in my 2nd year of residency that my wife and I were married, and then took us about 4 years later to where we had our first child. Our family was very important, and the planning for family was very important, and I think I was just so lucky to have a partner that understood where we were in both of our careers and both of our early lives, and when it was ready for us to actually start building and having a family. My mom on the other hand, and dad had me when they were just graduating high school, and my mom went to college and medical school as a single mom, and had me for a good part of that time. And when I think back on it, I don't necessarily know that I could put myself in her shoes and would have been able to do the job that she did, or would have been afforded the time and opportunity to be able to develop my career early on, if we were trying to build that family earlier than when we did. So I'm always very, this is the second time I've mentioned her because she's been so important to me, but it's, I'm always in awe and very grateful for the sacrifices that she made to do what she needed to do, because I don't think I could have done it. So I don't think we delayed family or made a sort of active decision to say, no, our careers come first and we need to finish this before we feel comfortable starting a family. It actually just happened pretty naturally that say, hey, are we both ready? Yeah, let's do it.
That's great. And can you talk a little bit about the costs? Like, how did you pay for your MD, MBA?
Yeah, so finances are going to function a lot into this. And in fact, when I give this talk to students, or when I give a talk to students about Again, I talk about other things about time management, how to focus your attention, try to craft the life that you want to. I tell them to focus on the big F's. And that's family, friends, finances, fitness, meaning like your wellness, and fun, making sure that you're having a damn good time doing whatever you're doing. And if there's something that you don't like doing, well, you should probably figure out how to delegate it or drop it completely from your life. But finances are a really important part of it. Now, money doesn't buy happiness, which is the old adage, but money does buy time and opportunity, and that time and opportunity for you to find what brings you happiness and joy. Medical school is not inexpensive, nor are pre-professional degrees, and there's a lot of delayed income and sunk cost from getting the education that we get when we want to be in the health science or a health profession. There are many ways that you can finance this. Some, if you're lucky enough to have parents, grandparents, and or family members that can provide financial assistance, so you avoid taking out debt. To the other end of the spectrum, where you completely finance it by taking out 100% of debt for your medical education. Then there are things in the middle that can put that together. So one, a mix of personal finance and debt or loans, and then also supplemented by scholarships. So there are tons of free money that are out there, which you may have some sort of requirements and obligations like reporting or doing interviews and stuff like that, and giving back to the organization after you've spent some time in your professional work. I was lucky enough, as a result of my background, to get an Indian Health Service Health Professions and Services Scholarship, which effectively was a loan repayback by time. So they helped with medical school or paid for medical school. And in return, I would spend time working when I received my degree within the Indian Health Service or serving Indigenous population. So it fit well for me for what I wanted to do, what I was interested in, and of course was lucky enough to receive that scholarship. Secondarily, for business school, I applied to a few other professional scholarships, minority health scholarships or minority business scholarships that I was eligible for. And there are several clearinghouses that people can go to see what scholarships they would be eligible for. And then also, I know some of my classmates, for example, did similar professional payback setups where their consulting job, or if they were already in residency, their residency would send them or defray the cost if they agreed to sign up for a certain time of employment. So there are several ways that one can finance the education.
Yeah, and now that you are done your MD MBA, in terms of what does your schedule look like now? Like how much % of it is like administrative work versus clinical work, things like that?
Sure. A few things that are really important for people. When you go into administration, you're never going to get paid what you think you value. So you should understand that very, very quickly. Oftentimes it's a thankless job, and you are there to solve people's problems. So if you're not used to or comfortable with hearing about people's problems and hearing about them often and being accessible to them, it may not be the route for you. As it breaks down, I work roughly a half-time clinical schedule. So for emergency medicine, sometimes that can be anywhere between 110 to 140 hours, depending how you break it up. And if you think that's consistent with a 40-hour work week, would be 160 hours a month. But on average, if you say, hey, for emergency medicine, we work about 120 hours a month. I try to work between 6 and 8 clinical shifts. So that works out to be like 60 or 80 hours. And then what I have left over, that 60 or 40 hours is dedicated to administrative time. Like today, I have an administrative day where, I got up, got to the gym, got the workout out of there, got my kids ready for school, and then got to the office at 8. And then I'm going to work until about 4 or 4:30. And then I have an impromptu dinner with my chief medical officer here, where we're going to go talk about several other strategic initiatives that he would want me to be a part of. And again, that's part of my work in building a network. So, I'll be out until about 7:30, get home at 8, and hopefully have time for bedtime, and that'll be the day. And then saving that either hour or half hour to catch up with my wife, Kelly, watch whatever Netflix binge we're on, one show of that, and then get to bed and do it all over again. And that's probably what a typical day looks like for me. And in a clinical day, it depends on what shifts I'm working on. But again, those are between 10 and 12-hour days based on direct clinical work, as well as doing some charting and stuff afterwards. I wake up in the morning and I try to avoid the first thing to look at to be my email or my personal device. I try to take a few seconds to breathe, stretch out, and get ready for the day. And then, as I said, I know that I'm going to be tired or sort of wiped out towards the end of the evening. And sometimes things come up like, little fires that you have to put out towards the afternoon. And if that would interrupt like a workout time, and I know I'd be tired at the end of the day, so I probably wouldn't want to work out. So for my willpower, I need to put that early on in the morning, and I feel like that gets me ready for the rest of my day. So that's sort of how my timing works out. I'm very lucky in that Kelly works from home and she's part-time, so she's able to get the kids off to school and daycare, pick them up in most days. And if I have something where I have to stay later at work, she's okay with compensating for that. And another reason why we moved to Northern Virginia, we have family around us now that are able to help out. So grandparents, aunts and uncles, and whatever support network you can gather around you, it's invaluable. They've been incredibly helpful as well.
Great. So my last question is just about some parting advice, particularly for Indigenous students. What type of parting advice do you have, or any book recommendations that you really like, especially for someone who is considering an entrepreneurial or leadership path? Do you have any recommendations?
Yeah, I often get asked, is there a perfect candidate, or is there a perfect job for somebody? And the answer is no to both. There is no perfect candidate. You are the person you are, and you need to bring your whole authentic self and all your lived experiences and thoughts and ideas to whatever opportunity you think you'd be interested in. And don't be afraid to share who you are or where you're from, because of what you think would be some preconceived notion that would be, either a check against you or a check for you. So I know growing up or where I came from, I never felt that I would be smart enough, good enough, have the experience or the connections to be successful in a professional arena. But thankfully, I had a few mentors, and that's all you need. Probably even just one person who would be able to talk you up to say that you can do this. And at each step of the way, when I got scholarships to go to college and got accepted to Yale, I didn't even know what the hell an Ivy League was. I had never been east of Ohio. And when I get the acceptance letter, I'm happy, but then immediately I'm like, oh, damn, I'm not ready for this. I can't do this. But then you have that one person that says, well, they never would have accepted you if they didn't think you could do it. So you've already proven to everybody else that you could do it. You only need to prove it to yourself. And that happened at the next step with business school, right? And with medical school. I was like, holy, there's no way I'm going to Harvard. You mean that part of the movie that was, oh my God, I'm Good Will Hunting, right? One of my favorite movies. I'm going to that place and going to be there in Boston. And then similarly for the business school, right? Did terrible on my GMATs and went for my interviews, and they were like, we think you're going to be okay here. And here are the reasons why. And I was like, I was having all these other people believe in me, but I was the last one that needed to do that. So you need to talk yourself up, know that you can do it regardless of where your background is from. And once you've hit those steps and reached those particular goals, then you need to find a few good friends and at least one good mentor to help you work through all that. With regards to, is there a perfect job? There is not. There is no perfect job. You are going to have to craft the job that you want. And when you get into the position, there'll be titles, there'll be roles, there'll be responsibilities that that's pretty standard. But how you operate in that and how you think you're going to be effective within an organization is entirely up to you. You do have to develop some skills, as I mentioned, like time management, email etiquette and communication is absolutely huge. Knowing that you need to create or craft a vision and a strategy for your teams if you're leading other people, and certainly getting very comfortable with change and managing that, and how to coach and support people through that. And certain challenges that like difficult conversations you never thought you'd have to come up, like somebody's parent or loved one had died, somebody's going through divorce, somebody's having substance use issues, somebody's having real performance issues on the job and at risk of losing their job. Like, you never think that you needed to have these conversations, but they're going to come up all the time. Don't be blindsided by them. So in that, I would say there's the 80-20 rule, the Pareto rule, with regards to the stuff you love about your job and then the stuff that you don't like about your job, it holds. You're going to love 80% of what you do, and 80% of your day, you're going to love what you do. And then there's 20% where you're just going to be like, oh, is there any way that I can avoid this or get rid of it? And you have to focus on that 20% because it's going to sap most of your energy. So either one, having a plan of how you're going to approach those problems that are going to come up. Two, again, finding a lot of good friends and some mentors who are going to support you and maybe give you advice. And three, just getting comfortable with that. I'm not going to love everything about my job, but if I love most of it, then maybe it's worth putting up with this 20% that kind of bothers me.
So that was Dr. Ken Bernard, who is one of the most inspiring individuals in healthcare I've met. The biggest takeaways for me from our conversation was when he said, just to be a doctor isn't enough these days. Our communities need us to be much more. You're going to be a counselor, an advocate, you're going to get into social, political, and legal issues you've never thought you've had to manage. And as the first of the series of videos that I'm making on alternative MD careers, I want to talk to doctors doing just that. So thank you everyone for listening, and don't forget to subscribe to be notified of future lecture recordings.